Welcome to Bullet Point Nursing. My name is Dr. Goldstein. Let's get started. Today we're continuing our series of systems-based diseases, and we're talking at the level of nursing fundamentals. Let's begin with talking about disease transmission, and we start with the chain of infection. In order for someone to become infected, we have to go through a number of steps. First is there has to be a reservoir, which is where the pathogen is held. This can be a human, an animal, or the environment. Next, the pathogen has to exit that reservoir in order to travel to infect someone else. That is called the portal of exit, and it is how the pathogen leaves its host. Next, we have the mode of transmission, or how it makes it to its next target. These can be direct or indirect. Direct includes contact or droplet, and indirect includes vector-borne, such as through a mosquito, airborne, or vehicle-borne. Next, we have the portal of entry, which is how the pathogen enters the host or our patient. And finally, the host must be susceptible to the infection. In addressing disease transmission, it is our role as healthcare providers and public health in general to try to break down this chain of infection and put up as many obstacles as possible for a pathogen to complete all of these steps. Next, we have a few different levels of prevention, and let's talk about each of them. The first one is primary prevention, and this is intervening in advance of any adverse event, such as an illness. Examples of this are vaccinations, improving adverse habits, and other such interventions. Secondary prevention is the routine and early identification of health events. This includes such things as screenings for mammograms and colonoscopies, taking your blood pressure, and many others. Please note, in this conversation now about prevention, we are not focused specifically on disease prevention. We're talking on adverse health events in general. Next, we have tertiary prevention, and this is managing the adverse events once it has occurred. For example, if a patient develops shock, we want to be sure to avoid complications such as hypoxia or hypotension, which are low oxygen levels and low blood pressure, because these can cause tertiary events such as the patient getting a brain injury. Next, we're going to talk about various levels of precautions. Many of you are likely familiar with standard precautions, also known as universal precautions. This is used in the healthcare setting for every single patient encounter. This includes hand hygiene and more aspects of PPE, personal protective equipment, based on the situation you're dealing with. If you're just going to be putting your hands on the patient, then you would wear gloves. If there's bodily fluids that may be spurted out, you may need glasses, gowns, and other such items. Next, we have contact precautions. This includes gown and gloves and more as needed to prevent any contact with the patient or their environment. Examples of situations where you would need to have contact precautions or where a patient would be labeled as being on contact precautions are C. difficile or MRSA. Next, we have droplet precautions. In this case, you wear a mask when around the patient, and the patient should wear a mask when being transported around the hospital. Examples of patients that would need droplet precaution are influenza or strep throat. Finally, the highest level is airborne precautions. Airborne precautions are preferred to be treated in a negative pressure room. The patient should be wearing a mask, and the provider should be wearing an N95 or higher level mask. Examples of this are tuberculosis, measles, smallpox, chickenpox, and others. Next, we have signs and symptoms of infection. We only have 3 listed here, which are tachycardia, a high heart rate, tachypnea, a high respiratory rate, and hyperthermia, which is a high temperature. There are many other signs and symptoms of infection that we may see depending on what infection the patient has, such as pneumonia. However, the way it impacts our vital signs in terms of heart rate, blood or respiratory rate, and temperature are that an infection increases each of these. Moving on from assessing our vital signs, we can look at how we assess some labs. The most common lab that is assessed relating to an infection is the white blood cell count, or WBC. This lab is found on a CBC, which is a complete blood count, and this is one of the labs, a WBC. The normal range for this is 4.5 to 11, and that is technically 4,500 to 11,000. A white blood cell count would be elevated if a patient has an infection. Because a white blood cell is one of the primary aspects of how we fight off infections, when the body is fighting an infection, it's going to produce many more white blood cells. This would make the lab come back higher than 11, showing that the body has increased its production of white blood cells to fight an infection, and that is how we use that lab. The lab may also come back low, below 4.5. And this would be in a case of a patient being immunocompromised, where something is damaging their immune system. This can be from medications such as cancer-treating drugs, which are called chemotherapy. It could be from a cancer, or it could be from other causes. We have two labs that we assess that look specifically for inflammation. The first one is an ESR, or erythrocyte sedimentation rate, commonly called a SED rate. An elevated ESR is a sign of inflammation. However, it does not necessarily mean an infection. We do commonly see this elevated in an infection, but it can also be elevated in patients that have trauma or other pathologies going on. Next, we have a CRP, which stands for C-reactive protein. This is another lab that is also used as a sign of inflammation. Again, it is not very specific because there are other causes of inflammation besides an infection. When we do have a patient with a suspected infection, specifically one that is systemic, we may assess blood cultures. Blood cultures are 2 jars that we draw blood into, and we use this to determine what pathogen is this patient infected with. A nursing point to note, most commonly, blood cultures are drawn in 2 sets. When it's done in 2 sets, we draw one from one IV site and one from another IV site, if possible. If we only have one IV site, then that cannot be done. Next, we have culture and sensitivity. This is another lab test, also referred to as a C&S. This is where we grow a sample of the pathogen in the lab, and we determine what this pathogen can be killed by. By determining this, we can identify to make sure that whatever pathogen this patient is infected with, we now know for certain, based on their C&S testing, that, for example, amoxicillin will kill this pathogen. I want to cover something called antibiotic resistance. This is a global health concern relating to pathogens that are not able to be killed by antibiotics. This is a major issue because we want all pathogens to have an antibiotic available to us that we can use to destroy it before it harms the patient further. There are a few key notes that nurses can intervene to address this concern. First is preventing infections and preventing the transmission of infections. Some common aspects of a nurse's role is to teach good hand hygiene, to teach when a patient needs to isolate, for example, in the first 24 hours of being diagnosed with strep throat, and other such methods of disease prevention and prevention of transmission. Another nursing role related to antibiotic resistance is to educate the patient to fully take their prescriptions as prescribed. We do not want a patient to stop taking their antibiotics because they started feeling better. We want them to complete their full course of it. And finally, at the provider level, we most importantly make sure that we are correctly prescribing antibiotics and not over-prescribing antibiotics. This is called matching the drug to the bug, where we want to make sure that whatever pathogen the patient has, we are prescribing a medication that is able to destroy that pathogen. We do have a number of different types of pathogens, which we will discuss much more extensively in Med-Surg. Bacteria, fungi, virus, protozoa, and parasites are 5 different types of pathogens. Please note, these each have their own classes of medications that are designed to treat them. These are not interchangeable. A patient who has a fungal infection cannot be treated with antibiotics. A patient who has a viral infection, such as rhinovirus, also known as the common cold, cannot be treated with antibiotics, and so on and so forth. Finally, one last note on infectious disease is there is local infections and systemic infections. A local infection is where an infection is isolated to one organ or area. A systemic infection affects multiple organs or areas or is in the bloodstream. Thank you for watching. Here are your references. Have a great day.